Hello, my name is Dr. Patricia Murray. I am a doctor of osteopathic medicine, and I specialize in neuromusculoskeletal medicine and osteopathic manipulative medicine. I have taught continuing medical education courses for 8 years. I have primarily taught these courses at the University of New England College of Osteopathic Medicine, but I have also taught them internationally. The purpose of this promotional video is to let you know about a series of video courses that I am putting together that will focus on the laboratory demonstrations of 5 core osteopathic manipulative medicine techniques. The 5 core techniques are 1. Muscle energy, 2. High velocity, low amplitude, 3. Strain, counterstrain, 4. The still technique, and finally a number of soft tissue techniques. This series of courses will start out with an introductory course that will focus on the history of osteopathy, the principles and practices of osteopathic medicine, and then a series of lectures followed by short labs on each of these 5 core osteopathic manipulative techniques, talking about the history, the philosophy, and the concepts of each of these techniques, and then demonstrating how you do each of these techniques from a basic perspective. The rest of the series of courses will divide the body up into regions. First, the hip and lower extremity, then the pelvis, third, the lumbar spine, 4, the thorax and ribs, 5, the cervical spine, and finally, the upper extremities. The purpose of each of these courses will be to demonstrate how you do all of the 5 core techniques for each of these regions of the body. At this time, I would like to show you an excerpt from a sample lecture, followed by some sample laboratory demonstrations that you can watch and see how this material will be presented and the quality of the video. I hope you enjoy this demonstration, and if you do, I'll be back to talk with you about how you could learn more about these series of courses and how you can possibly purchase it. Osteopathic medicine started in the 19th century. Andrew Taylor Still, who is the founder of osteopathic medicine, was actually originally trained as an allopathic physician. He was an MD. He practiced medicine in the Midwest in the 1800s as an itinerant physician. Osteopathic medicine, when he started it in the 1800s, was a change and a move towards a more holistic medicine that looked at structure and function and trying to find more gentle ways of treating patients. There are many techniques in osteopathic manipulative medicine, and this course is meant to give you the core treatments and to be able to become effective with those. Medial portion of the clavicle. Get your fingers on the clavicle and then just drop right down into the costoclavicular space, right onto the first rib, and palpate for it. So as you can see, the pads of my fingers are again in the posterior soft tissues of the cervical spine. If you feel behind the cervical spine and you feel for the spinous processes, you want to go just lateral to that with your finger pads. I can then also have her turn to the left, and when I bring her into flexion in this position, I am mostly stretching the left side paraspinal muscles and put it into this angle between the fibular head and the femur, just like this. And then what you're going to do is reduce that angle between the fibular head and the femur. And you're going to take up the slack and reduce that angle. And just like we demonstrated with the skeleton, I'm going to put my MCP joint, this joint, in the angle between the fibular head and the femur. I'm going to bring her heel towards her femur in order to close that angle or decrease the angle and bring the fibular head right against my MCP joint. I can come back to neutral and retest by lifting and putting the scapula through numerous motions and seeing, is there a certain area that still feels restricted, or is it all flowing and moving nicely now, which it seems to be. I hope you have enjoyed this material, and if you have, please go to my website, www.tmurraywellnesscenter.net, and there you will learn much more about how this series of videos is being put together and how you can purchase it.